Could you making the introduction, the clinical operation for us to do the demonstration of focus shockwave?
Sure.
Yeah. So we are going to do some the demonstration on how to use the focus shockwave.
Perfect.
Like for the beginning and the finish, like to the before and after comparison by using the focus shockwave.
Okay.
Yeah.
Okay. Do you have is there an injury that we're working on?
Not yet.
Okay.
not yet.
Do you have an injury? 你身上有什么部位比较
No.
Okay. So let's pretend that you have an injury here.
The shoulder injury.
Let's say it's a shoulder injury.
Shoulder injury.
That's one of the most common issues is shoulder. So what we would start with is I would have you stand up.
Yes.
And then we're going to go through range of motion. You're going to do this. We're going to come here. We're going to come down and back up. Then we're going to go behind the back. See how far you can go. Okay, can you go up here? Any pain? No? Okay. So we don't have any problem here.
Yeah.
But if we did, let's say this hurt, we would start with this. So I'd have you sit here. And then I'd come to the machine. Please have a seat. I'd come to the machine, I'd go to home, I'd go to the body, and I would find the calcific tendonitis, which relates to the shoulder. So that gets me there. And then I go to my therapies, and I press the green button, and I'm ready to go. And because it's the shoulder, we're going to increase the water because there's not a lot of muscle there. So we have the machine here. We're going to use a conduction gel. I'm going to roll up the sleeve. And then in my clinic, we grab one of those bottles of water. I'm going to have the patient move while I'm in therapy, right? But first we're going to start and we're going to just do it. We're going to go. So I find a spot. This is where my injury was. And now I'll have you move your shoulder. And then I'll move around the area. And I'll watch the patient's face for pain. Usually we'll have some pain in the insertion of the muscle. This would be a supraspinatus muscle here. And now I'm going to have you move your elbow up this way. Right. So I put the muscle into the range of motion until the protocol finishes. And then what I will do is I'll get the radial pulse wave and I'll do the same thing. And then I'll gua sha and we'll be able to see where the problems actually, the adhesions are on the fascia.
I see.
So, all right, I would start with this. I go bone, ligament, then radial focus, muscle, tendon. I move up, and then muscle, fascia with gua sha. So
the bones, ligament by focus.
Bones, ligament, because this goes deepest.
Yes.
So I start deep, and then I move superficial.
Radial is the
Muscle, tendon, yes.
And the gua sha for muscle.
Fascia.
Yes.
Yes. Okay.
Yes, thank you, Dr. Grant, for the demonstration on the focus shockwave operation.
Okay. But then once we're done with therapy, then we go through range of motion again, and we can see the difference.
Oh, I see. So after the focus shockwave, we'll do before and after.
After the whole treatment.
After the whole treatment.
We do focused, radial, gua sha, and then we reevaluate the injury. Because it's an immediate response. And what I tell my patients is, you'll know in the first treatment whether this is going to help or not.
Oh, I see. So in most cases, after only one treatment,
they'll know we're on the right track.
Oh.
Because most people that come to see me, because insurance doesn't cover this in America for me. You know, they pay it cash out of pocket. So they need to have a result to continue to come. So if they don't have a result, that'll be it.
I see.
But if they do have a result, I'll recommend they come back 3 to 6 times.
3 to 6.
Yes, and then we take a 30-day break and then we reevaluate after 30 days. And if we're 85% better, we might do more. But if we're not, we're probably as good as it's going to get.
I see.
Yeah.
Thanks so much for your sharing.
Of course.
Thank you.
Sure.
If you treat a pickleball treatment,
Yes.
Typically it will be around the charge for one treatment.
In my treatments, we charge $100 per area when people come in. So I'm very inexpensive compared to the market. Cheap, very inexpensive compared to my competitors. And because I want as many people as possible to get the help.
Yes.
Do they have healthcare?
There is health insurance and there are codes for this, but it's not really covered.
Our team is talking to doctors from all over the world.
Yes.
There are different countries, different situations, and every day we are talking with doctors. But really, the first time we sitting together face to face,
Oh, yeah.
doctor is our first time.
Oh, that's great.
I have a question.
Yes.
For the each part, how many shots you do for the part?
So it depends on the injury. If it's a shoulder injury, usually it's 1,000 shots.
1,000.
1,000.
1,000.
Yeah. 2 cycles through the protocol.
And how to do the treatment? Only one point or cycle to the pain point?
No, because the muscles have an origin and an insertion,
Yeah.
you have to hit both parts of the muscle.
Yeah.
So we'll start off by, if I'm doing a shoulder here, I need to do the back as well, where that muscle inserts. Yeah.
So the shots will moving to follow the shape of the whole muscle.
Right. Usually the problem's in the tendon.
In the tendon.
That's usually the insertion is usually where the problem is, but you need to fix the belly of the muscle as well because that's damaged too. You're welcome. Yeah.
Hi, Dr.
Hello.
I'm Rachel.
Hello, Rachel.
I want to know, so how long you use an applicator? You know, our applicator his is 500,000.
Yes.
Yeah, but I want to know, so how often you can use in your clinic?
Well,
The start.
I've been using your unit for 4 months
Yeah.
with no, and I'll do about
20,000 a week.
yeah 20,000 shocks a week.
Thank you.
So-
This question is many customer will ask.
Right. So it's if I'm doing it. So if I do 1,000 shocks, it's $100.
Yeah.
If I do 20,000 shocks, right, that's $2,000.
Yeah.
And so if I replace the head, that's half a week. Three days of work. So it's for the other unit, it would take me 2 weeks of work to replace the head. What's really interesting is I have friends of ours who who have horse races, have horses that race in the Kentucky Derby. And I was telling him about my Shockwave. He goes, "Oh, we use that on our horses."
Yes.
I was like, "Wow, that's amazing."
Yes. So, the PEMF.
Yeah.
We were selling a lot of PEMF to the house owners.
Mhm.
And focus too. Used to treat the horse legs.
Yes.
Yeah, because they need very deep penetration technologies to treat the horse.
Right.
Because the horse is big muscle, huge. It's a huge muscles.
Right.
But really a shockwave is too superficial for the so they choose focus shockwave to do treatment.
Right. So the PEMF goes deeper.
Yeah.
Yes. Yeah. So do you guys know the original use of Shockwave? What the original use was in the United States? Originally, it was used to break up kidney
Kidney
stones.
stones, yeah.
Right. So
And it's very large applicator.
big applicator, and it was very. They'd have to be sedated. You have to put somebody out to use it. So it's come a long way.
Yeah.
Yeah.
This is like a class.
Anybody else? Anything else you want to know?
What technologies have you used before?
What-
Why you choose focus Shockwave from us.
Why did I choose yours?
What technologies you have used?
Oh, so I'm 30 years in practice. So my main thing I used originally was ultrasound and muscle stim. Interferential muscle stim, Russian stimulation, and ultrasound. Those are the three things I used. I don't have those machines anymore. I just use this. I don't think it's necessary to have more than a PEMF machine and this for basic clinic function in the physical therapy world today. I mean, I know you guys have other modalities, but for everyday purposes, I think that would cover 95% of my patients.
Yeah.
So, yeah.
So the combination, the package, the focus Shockwave and PMF almost can solve different kinds of problems.
Right, because I don't have a PEMF machine yet. I'm just buying one.
Yeah.
But I have a practitioner in my complex that has one. So I'm sending her all of that work, because I think it's important.
Yeah.
So I'm already using it, but not in my office.
Yeah.
So.
And you just mentioned about the Zoom call.
Yeah.
It's really can make us and the clients more closer.
Super. I think that's a super. Having Stella on the other side of the phone showing me what I'm looking at made me very comfortable, because you don't know really when you're meeting a new company, it could be one guy in his basement.
Yeah.
And no product.
Yes.
And now you're sending money. And so seeing a factory, seeing the products, meeting the team is spectacular. Yeah. So. Yes.
Hello.
Hello.
My name is Emily. Yes, I have one question. Is
Yes.
the pain from the sports?
Yes.
Like the acute pain from the ankles. When you choose the Shockwave or the ultrasound?
I don't use ultrasound anymore. Zero. I only use the Shockwave.
Only use the Shockwave.
Yes.
Yeah.
Yeah.
How do you choose?
How do I choose that?
Yeah.
So in my limited understanding, my ultrasound machine, the top of the machine would start at the bottom of this machine, the energy. So, and I would usually use to work like an ankle, because that's mostly bone and ligament and cartilage. I would usually do the top end of the ultrasound machine. But now I don't need that, because I just use this. And the thing I really like about this is I can change the intensity as I'm doing the treatment as I need to. If I'm working on your ankle and it's very painful, I can lower the intensity very quickly so that you make it comfortable for you.
User-friendly.
Yes. Yeah. It's very user-friendly.
As my understanding, there are two types of the pain: the acute pain and the chronic pain. Can the focus Shockwave be used in the acute pain?
I use it in acute pain. Yes. The thing about the Shockwave is it's causing an inflammation.
Yeah.
And inflammation is caused because you're bringing blood flow, stem cell nutrients into an area. So if you have an acute problem, you're already inflamed, but we can create a better nutrient dense experience with a specific force into the area. So, and then for chronic pain, like for example, somebody has a knee surgery and they don't have full range of motion after 2 years. They can come see me and I will, in 6 treatments, give them full range of motion in their knee because I've broken up all the scar tissue that's causing the adhesions.
Yeah.
I see that a lot. My second patient in my office was this woman who couldn't lift her arm past here. And after the 5th treatment, she was like this and crying. And she flew her mom from Las Vegas in to have treatment with me 3 times. So I thought that was really very telling.
I have customers from Germany. He's a patient. He take the Shockwave and PMF, the same product from the brand, the product from the stores in clinic, and because he take a lot of the surgery and it's a chronic pain. He spend a lot in doing such therapy, so his daughter told him to buy one for the home use.
Yes.
So at the very beginning, he bought a combination machine. It's the radio shockwave and the ultrasound. It helped, but not a lot.
Right.
And later they bought a PMF, but the water cooling one. He provided me a feedback after one treatment. When he take a shower, he can lift his shoulder. So that maybe possibly next time you can also try the PMF on the mobilization problem.
Yeah. So.
Thank you, Dr. Ray.
You're welcome. Thank you.